everyone, myself Dr. Pooja Jain. I'm working as fertility and IVF specialist at Medicover Fertility, Vihat branch. एक बहुत ही important topic पे बात करेंगे, वो है AMH. AMH क्या होता है, इसका क्या significance है? AMH that is Anti-Mullerian Hormone, ये एक हार्मोन है जो ओवरीज that is अंडेदानी में प्री एंट्रल फॉलिकल्स स्टेजेस से निकलता है और यह बताता है कि हमारा ओवेरियन रिजर्व क्या है. दैट मीन्स हमारे अंदर एग बनाने की क्या क्षमता है. व्हेन अ फीमेल इज बॉर्न, वी आर बॉर्न विद अ फिक्स नंबर ऑफ एग्स जो कि एज के साथ साथ घटते जाते हैं. कभी भी हमारा AMH एज के साथ बढ़ता नहीं है और जब मीनोपॉज की स्थिति होती है तो ये एक नेग्लिजिबल अमाउंट में पहुंच जाता है. So what is the importance of AMH? As I told you, AMH is a predictor of ovarian reserve. Its normal range is 2 to 4 nanogram per deciliter. If it is between 1 to 2, then it is borderline low. If it is less than 1, then it is definitely low. And if it is less than 0.3, then it is extremely low. How to get our AMH report? AMH हमें एक simple blood test के द्वारा पता चल जाता है. इस टेस्ट को हम किसी भी दिन दैट इज महीने के किसी भी ड्यूरेशन में करा सकते हैं. ऐसा नहीं है कि इसको पीरियड के सेकेंड डे पे ही कराया जाता है. व्हेन टू एक्सपेक्ट अ लो AMH काउंट? इफ द फीमेल एज इज ऑन द हायर साइड, if there is any history of ovarian surgery, for example endometriotic cyst surgery, there is history of premature ovarian insufficiency or failure, that is when a woman attains menopause below the age of 40 years. If there is any history of ovarian surgery, if there is any history of cancer treatment like radiotherapy, chemotherapy which damages our ovary, there is history of tuberculosis, endometriosis, acne, autoimmune disease, for example SLE, जिसमें हमारी खुद की ओवरीज के अगेंस्ट एंटीबॉडीज बन जाती हैं और वो ओवेरियन टिश्यू को हार्म करती हैं. इफ देयर इज एनी जेनेटिक डिजीजेस, फॉर एग्जांपल टर्नर सिंड्रोम or fragile X syndrome, there is a history of smoking, then also we can expect low AMH value. So how to proceed when we get the AMH value? बहुत बार patients का question होता है कि doctor, how can we increase our AMH value? So it is very important to understand कि there is no measure by which we can increase our AMH value dramatically. Only some measures are there which can increase it marginally, or we can improve the quality of eggs. For example, we can work on our lifestyle. So we have to follow a good diet, that is low carb, high protein diet. We have to take good supplements which are rich in vitamin C, vitamin E, vitamin D, CoQ. These are the supplements which can enhance our fertility. Then we have to avoid smoking and drinking. Then exercise also plays a part, reducing your weight, then reducing stress levels, taking proper sleep. Then there is DHEA that also helps in these patients. And then upcoming is ovarian PRP, which is also helping in improving the AMH, but not dramatically. So how to approach a patient, or how to go ahead with the treatment when we encounter low AMH count? So first advice to the couple is that if they have low AMH, they have to act upon it very fast. They have to conceive as early as possible. So if the patient is having low AMH but the patient age is less, say less than 30 years, then we can first try with the simple management options like we can do ovulation induction along with the IUI. If she doesn't conceive with those simpler methods, then we can switch over to IVF. If the patient age is on higher side, say more than 35 years or 40, then we can directly suggest a IVF. So counseling is very important. If a patient is having low AMH, there is nothing to stress out, because it is not like that they can't bear their own genetic child. So with IVF, with self-eggs and pooling of embryos, that means they have to undergo more number of IVF cycles to get the optimum number of eggs and embryos to have the successful result. So with self-eggs, they can bear their own genetic child. If there is history of repeated IVF failures, or there are very poor quality embryos or very less number or previous negative results, then they can go ahead with the option of donor eggs. If you have any query regarding this topic or AMH, you have any doubt, please feel free to contact us at Medicover Fertility. Thank you.